The document published this morning sets out the government's so-called battle plan to deal with coronavirus if cases continue to rise in the UK. The key takeaway messages are that firstly, in a worst-case scenario, up to 80% of people in the UK could fall ill if the virus spreads across the UK. That's over 53 million people. However, the vast majority of patients would only likely experience mild, cold-like symptoms. The government also anticipates that a fifth of the UK workforce could be off sick at any one time if the virus cannot be contained. Speaking at a press conference in Cardiff Bay this morning, Wales's Chief Medical Officer, Dr Frank Atherton, said that he anticipates cases rising in number in the UK until a peak this summer. He added that a period of calm reflection is now needed.
The main message really is that we have a window of opportunity now to prepare ourselves against the eventuality of a significant outbreak of coronavirus in the UK. And that's something that we need to think about for individuals, for organisations and of course for the NHS.
So how have we got to where we are today? On New Year's Eve, Chinese authorities alerted the World Health Organization, the WHO, to a suspected outbreak of pneumonia in the port of Wuhan. Within a week, the WHO identified the virus, named COVID-19, as belonging to the dangerous coronavirus family. And on the 11th of January, the first person died, a 61-year-old man who had bought food from Wuhan's seafood market. As the death toll rose and the virus spread beyond China's borders, the WHO declared a public health emergency at the end of the month. The next day saw the UK's first case. Since then, the UK count has risen to 51, with the first Welsh case announced last Friday. February the 28th also saw the first death of a British citizen to coronavirus, who was infected aboard the Diamond Princess cruise ship in Japan. Today, the Welsh Health Minister Vaughan Gething said that the public now has a big part to play in containing the virus.
Good hygiene in particular is the most effective way to protect against all manner of illness, whether you have a cough or a cold, to do what we should all do anyway: catch it, bin it, kill it, and wash your hands. If anyone is worried they may have had contact with a confirmed case or travelled back from an affected area, they should stay at home and phone 111, which is now available across Wales for coronavirus concerns.
So what's next for coronavirus? Well, although today's action plan details a worst-case scenario, the government hopes that public health measures can help to mitigate the risks. Washing hands, disposing of used tissues and avoiding close contact with people who are unwell were all recommended by the Chief Medical Officer today. As the virus is new and nobody has biological resistance to it, everyone has a part to play in limiting the spread of the virus in the UK. Erin Santillo, CJS News.